Okay, good afternoon, everyone. Looks like we still have some logging in, but we will get started as it is noon. Thank you all for joining. I'm Dave Webster. I'm Director of Acute Care Operations here at the University of Rochester Medical Center. And welcome to the May edition of Lunch with a Leader, which is being hosted by the New York State Council of Health System Pharmacists Leadership Development Committee. If you are able to, please turn your cameras on throughout. It's nice to see everyone's smiling faces. I realize not everybody can do that, but if you can, that would be wonderful. And it's really my honor and privilege to introduce today's featured speaker and somebody who's going to give us their time to really spend some time talking about polishing your public speaking. And I'd like to introduce to you one of our most accomplished and admirable leaders in pharmacy today, really, Birnie. And I want to share a little bit of background to get started, and then I'll turn it over to Dr. Birnie. So Christine has served as Dean and Professor of the Wegmans School of Pharmacy at St. John Fisher University in Rochester, New York. She joined the school in 2006 as a founding faculty member, was promoted to Department Chair of Pharmaceutical Sciences in 2010, and has been serving as Dean of the school since 2017. She received her BS in pharmacy from the Philadelphia College of Pharmacy and continued her studies at the same institution, completing a PhD in the area of pharmaceutics. Dr. Birnie initially worked as a community pharmacist for Rite Aid Pharmacy and a formulation scientist for Mariel Limited, an animal health pharmaceutical company, before moving into academia. She then joined the faculty at Palm Beach Atlantic University in West Palm Beach, Florida, and later St. John Fisher University, where she has spent the last 16 years of her professional career. Dr. Birnie continues to stay actively engaged in teaching, research, and service. She teaches sections of pharmaceutics and compounding in the PharmD curriculum, has developed and teaches annually an elective course entitled Introduction to Medical Missions, and precepts final year students in clinical rotations related to international medical missions and local community engaged learning. Her scholarship activities include working with students and colleagues on projects related to academic pharmacy, leadership, international outreach, service, and local community engagement. An avid proponent for service and volunteerism, both locally and abroad, Dr. Birnie has participated in more than 30 student-based medical mission trips around the world and leads a medical service trip to India annually. She is actively involved in the American Association of Colleges of Pharmacy, AACP, Academic Leadership Fellowship Program, and is a member of the American Association of Pharmaceutical Sciences, American Pharmacists Association, and the Christian Pharmacist Fellowship International, where over the years she has served in various elected positions and committees. Currently, she serves on the board of directors for St. Joseph's Neighborhood Center, Mary's Place Refugee Outreach, and India Connection. Dr. Birnie has been the recipient of several awards, including being named Woman of Excellence by the Rochester Business Journal, Rochester Champion of Pharmacy, Fulbright Scholar to India, St. John Fisher University Diversity Innovation Bricoleur Award, and the Christian Pharmacist Fellowship International Warren Weaver Service Award. So it's my great privilege then to turn this over to Dr. Birnie. Thank you so much for your time and welcome.
Thanks so much, Dave, for having me. And thank you to everyone. I appreciate the opportunity to be able to share with you today. And as I understand, the format here is really a lot of Q&A and a lot of engagement. So I've prepared a short presentation for us on this topic, but really it's an opportunity for question and answer and kind of engagement with the audience on really any topics, and happy to be able to share about this topic. There's no doubt, as a leader, you have to do a lot of public speaking, a lot of standing in front of individuals. I will say this season of the academic year as a dean, I think I have about 10 events in the next 2 to 3 weeks. So it's, and that's what you do. I think as a researcher, as a pharmacist, as a clinician, as an educator, we do a lot of talking, a lot of communicating, whether it's teaching your patients, whether it's a formal presentation, standing up in front of individual, whether it be your healthcare team, or it's at a conference presenting, or maybe you're doing a guest lecture like some of you do for us here at the school, which we greatly appreciate. So there's many different roles where we have to be engaged in public speaking, and we take that as an opportunity. Certainly to advocate for the profession. Sometimes it's advocating for our patients, and it's a lot of times advocating for our expertise and our subject matter, whether that be in a research presentation or maybe a type of a lecture or some other information in that way. So I have just a few slides for us, about 10 slides. I'm hoping this would be kind of about a 15-minute presentation for us and really some time to kind of dig into a few points around public speaking, and then really to open the floor for questions, engagement. Appreciate others have other tips. I'm certainly not an expert in public speaking, but certainly end up doing a lot of it. And I think the more you do it, the better practice, the better you get at it. And there are many different forums for it. And so we're going to talk a little bit about that today too. So let me share my screen and present a few slides for us to have some conversation around these pieces now. So again, appreciate the opportunity to be here. I know you have, if you've been coming to these series, you're hearing from a variety of different people. I have not been able to attend them all, but I look at all of them when they come in my mailbox thinking, these are great. So it's a great idea for the organization to be doing these lunches, and appreciate the opportunity today to be with everyone. So a few things we're going to talk about today is looking at the types of public speaking and presentation events that you might attend or might be asked to participate in. And the way you're going to prepare for those, or even the way you present yourself, may be very different in those types of settings. So if you're doing a graduation speech, for example, or you're doing a lecture, you're going to prepare a little bit differently, and your presentation of that will likely look different at the end. And then we'll look at some strategies for some really effective ways of doing that. All of you have had training in this to some degree, whether it was in pharmacy school or you took a public speaking course. Some of you are better at it than others. Some of you love it. Some of you hate it. And that goes for all of us. I will say, as much public speaking as I do, it still is nerve-wracking. The nerve-wracking little stomach, twinges is a good thing. And that helps you be on your toes. It helps you be alert and ready. And we know that it's positive typically in our presentation of things. So it does get easier with practice, but it doesn't mean all the nerves go away. It's good to be on your toes. So to talk a little bit about some of these pieces, what are the types of presentations that you might do? So a speech for a public event, maybe it's a residency graduation, maybe it's a ceremony of some sort, a white coat speaker. I might be asking some of you to come and be my white coat speaker or my graduation speaker. We'd love to get individuals coming for those types of events. So if you're preparing that, it's typically a little different, right? It's a structured type of speech that you're likely going to write out and really prepare. It's short, it's sweet, and we'll talk a little bit about that. Another thing you might do that some of you may get engaged in on the advocacy side is doing a media interview. And this is sometimes you want to do a little additional training for that. But a lot of times it's expressing your expertise. As pharmacists, we are medication therapy experts. We're drug experts. We are disease state experts in these particular areas. And so we want to be the individuals that the media is contacting and be able to give the appropriate information, sharing our expertise with the community. And it's a wonderful way to really showcase what pharmacists know and how they're engaged in the community. So I would encourage you, be prepared for these and take those opportunities when they come. That said, preparing for that is really important. And because media interview, we often don't get a lot of opportunity to do some backstepping. Whatever we say or we share there, we're not always sure what's going to end up on the media and what pieces they're going to take from maybe our interview. Then a presentation that might be probably most familiar to this group is really your content expertise. You're giving a lecture, maybe a research presentation, even a poster presentation at a conference. And probably a lot of you have done these in its various forms. You might also be doing this in your day-to-day in your clinical setting where you're presenting on a patient or presenting a case to your clinical team or maybe to a group of students. I know many of you are preceptors. So this type of area where we are presenting truly on our expertise in our content area. And then you might also be asked to be on a panel or an interview type session. And one of the things we talked about, Dave and I today, of should we do more of a question and answer where maybe we have a small panel or we have people asking questions. And I've done that with some of my alumni, or sometimes a panel of different individuals working in different different areas of pharmacy, and expose that to the students. And so I'm asking them questions, and that presents a nice opportunity for engagement as well. So a lot of different opportunities. It's good to mix it up and be aware all of those opportunities that are available, and be clear when you're presenting what to expect in each one of those settings. So let's talk a little bit about your preparation for those. I think that's a really important aspect of no matter what you're doing, you need to make sure that you understand the context. You might want to request a content call, or maybe it's through an email. So I'll say, even as I was preparing for today, I asked Dave, well, how many people typically come to this session? How long should it be? What are your expectations? What's been done previously? You want to know who's going to be there. Is it just pharmacists? Is it technicians? Is it students? You want to know your audience well, so you can gear the conversation and the topic specifically to the individuals. You want to also make sure you really know the organization. So I'm familiar with NYSCHP, as we've been here in New York State for a while. We work very closely with them. But if you're maybe giving a presentation for an organization, or maybe a school, or a place where you don't know the organization very well, you want to make sure you do your research on that. And so you can add a few things maybe to your talk about the organization or about the profession, whatever the context might be. You want to find some aspects of relatability. So easier for me today, I'm a pharmacist, I'm a pharmacy educator, I'm a preceptor. I've worked in a hospital over the years, not many years now, but I understand the context of these settings. But somebody coming from the outside, or maybe you as a pharmacist are going to speak at a nurses conference, or outside of healthcare, maybe it's a community members, and you want to understand the organization and the audience that you're connecting with, and make sure you have some relatability pieces. I was recently at a conference, and in the context of thinking about today, and was listening to Coach K. He was the guest speaker from Duke University's basketball team. And so Coach K was sharing at the NACBS conference just a week or two back. And I was really impressed with how much he knew about pharmacy, right? So here's somebody who's a basketball coach, right? Of course, he's been invited to come as a big speaker to this conference, but he shared quite a bit about his experience with pharmacy, what we do, the activities there. He was extremely positive about pharmacists, really important. Okay, so the positivity of that, relatability of how pharmacists, accessibility in the community, and his aspects of that. Important to make sure that you find those connection points and really understanding the audience that you're with. So that preparation and that kind of researching even before you come into your presentation is really critical. And then you have to think about how you're going to prepare your speech. So let's say this is a talk for a white coat ceremony, or a residency graduation that's coming up here in a couple of weeks, and some of you might be involved in that. So you want to choose a topic, maybe something that's going to be leave a little nugget of information for people. So if you're presenting your research, it's easy. You know your content area, or you know your expertise. But if you have to come up with something a little bit more innovative, I have a guest speaker coming in for graduation in a week or two. And I spoke with him this morning and went through, what are you going to, how can I help you? What else, how are you doing with your speech? And so, his comments, well, I'm going to thank people and I'm going to inspire the students at graduation. And, so is it things around leadership, maybe overcoming obstacles, something inspirational, congratulating the group, whatever it might be, but really choosing something. Maybe it's your own personal journey of your own leadership development, or a large obstacle that you've overcome. And these can be very inspirational. And you think about that ahead of time, so that when you're going in to think about your talk, you want something that people are going to walk away from and be like, wow, that was really moving. And, 2 months later can still talk about a little bit of that, and not just, oh, Christine Birnie came and spoke at our graduation talk. And I don't know what she said. I guess she said something encouraging, or I don't remember anything. So think about some things that are going to be relatable, relevant, maybe a personal story. Personal stories stick with people, right? So those can be very captivating. Maybe it's a fact or figure. 95% of individuals in the United States live within 5 miles of a community pharmacy, right? We use that one a lot over the last couple of years with COVID. People know that now, right? And that's a great statistic that people can utilize. Wow, I didn't realize there's a community pharmacist or a pharmacist so close to me all the time. So choose a couple, maybe facts, figures, a couple statistics, a personal story that's really going to stay with people. I'll tell you another piece that we have seen a number of years at St. John Fisher's University's graduation ceremony. We would often have Senator Schumer stop by just randomly at the graduation ceremony, which we have appreciated. And he comes and gives a speech, and he's given that speech numerous times. And so those of us on the faculty have heard it more than once. But it is very good. And he tells a personal story about taking opportunity. And, he turned down some opportunities because of a girl, right? And he wishes that he had taken this opportunity to do this and that. And we joke about it in the faculty because we've heard it several times, but it's actually an excellent speak. It's a captivating story. And we can all tell his story of how he missed this opportunity because of the girl who was gone, 15 minutes, 2 weeks later after he turned down this offer, so the personal stories, right? And the ways to connect and find some pieces that are really going to be relatable to people. So some people like to use a joke as they open things up. Some people like to wrap in humor. And I was thinking a lot about that because for those of you that know me, I'm not this super funny person of humor doesn't really work well for me. I have a little bit of a dry humor, which I might sneak in here or there, and that'll work. But if I tried to tell a joke at the beginning of a speech or the end of a speech, that's going to fall flat, right? Because that's not authentic who I am. And so the recommendation is really be authentic. If you're funny and you're telling jokes and it's a natural part of who you are, then yeah, you could wrap that into your speech and keeps the group kind of lighthearted and wraps it in well, but be authentic to who you are. And then it's going to be easier for you. It's going to be relatable to your audience and people are going to see that. So don't be contrived and try to pick out something that really isn't going to work very well. A few more pieces as your presentation, preparing for that is really think about writing out your speech. So again, if you're giving a formal talk of some sort, you probably want to write that out in details, at least bullet points, have a sheet in front of you. But I have found over the years, if I'm at a podium, much like in this picture where it's graduation, white coat ceremony, and award ceremony, all these events I've got coming up in the next couple of weeks, even if it's a paragraph, I write it out. I've got it in front of me. It's in a notebook on the podium, ready to go. And if you're my speaker, my graduation speaker that's coming in 2 weeks, his speech is due to us by Friday, right? And so we'll have that in the podium with the 6 or 8 other speakers that are going to be there throughout the event. Put that in a notebook, a folder. A lot of people like to pull out their phone right now and they have it on their phone, whatever you're comfortable with. Make sure it's double-spaced, large, bold, one-sided paper. Those are my tips. I don't like to be flipping on the back of paper when you're turning pages. A couple years ago, we had graduation and they had little cards that people were reading. The students would come up, hand you the card with their name on it, their phonetic spelling, and then any awards that they had. And whoever printed them off, God bless them. It didn't come from the School of Pharmacy, but they printed it in, and I want to say it felt like 10 point font, right? And it should have been like 16-point font, right? And I did not bring my reading glasses up on the stage, right? Because my eyes are pretty good, but I'm sitting there struggling trying to read this. So make it a larger font, just even if your eyes are fine, right? You want to be able to quickly look down at this material and grab a couple words and then be looking up again. So make it a larger font, even if, your eyes are fine, you don't need glasses. Large font, double space, bolded words. So if you're going to highlight some points, you have some bolded words. So again, you look down, you quickly look up, you can see those bolded points and then carry on, even if you're not looking at your notes nonstop. So those are just a couple tips that I would recommend in that way. Practice, practice, practice. There's nothing like it, right? You want to be a good tennis player, you have to practice. If you want to be a good speech, give a good speech, you're going to have to practice it. And there's no getting around it. Yes, we think we've done this for a lot of years. I can just get up and ad lib. And yes, some of you can, and sometimes it goes a little smoother than others. But if you're giving a formal presentation, you want to make sure it's professional, appropriate, and you're going to do a good job. Make sure you practice it. And there's just no getting around that. Goes without saying, but eye contact is critical, right? We write out a speech, we've got it all written, we can't stare at it. We've got to find those bolded words, you've got to find those catch points, keep the body language going, smile. I tell students that a lot, people tell me that sometimes. They're texting me, Christine, make sure you smile, because smiling goes a long way. If we're standing there and our face is a little down and we're a little nervous and we're staring at the screen, especially on Zoom, you've got to smile. Keep that smile on your face, get a little animated, a little bit excited. If you're not excited about your content, how do you expect your guests or the individuals that are listening to you to be excited? So those are critical pieces. Switching gears a little bit, I thought we talked just a few minutes about a media interview. And so some of you have probably done these, other of you may be scared to death to do them. And some of you watch them and say, wow, I could have done a better job than that. And I do that too. I usually watch my own and then I say, oh my gosh, I can't believe that. But the media interviews are a pretty interesting piece. It is nerve-wracking, but I would say, take those opportunities. This is what leadership is about, and being an advocate. And sometimes we got to step out a little bit of our comfort zone. And I would say media interviews are sometimes that. A big key to your media interview is make sure you prepare. You know what the topic is ahead of time. Find 3 points, 3 statistics, 3 points you want to make, you want to drive home, whatever it is. Make sure you have those solid and keep reminding yourself of those 3 points. You're going to drive home those 3 points. They're going to ask you a lot of different things. And if you can't answer the question or you don't want to answer their question, you bring it right back to your 3 points. And even if you've already said your 3 points, that's okay. Bring it back again. You got to think about what you want to communicate and be able to effectively communicate that. They're only going to take a short clip of your media interview. So they might ask you 10 questions and you're there with them for 10 minutes. They're going to take about 20 seconds, 30, 40 seconds of your interview and put it into the news story. Now, maybe other opportunities, depending on what it might be, but that's a very common thing. So you don't know, right? So I have lots of funny stories that I can tell you of my own that I've done. And then I'm like, oh my gosh, I can't believe they took that clip. I said all these important things and they took some strange thing that I said and boom, they used that, right? So, but I will say most of the time, drive home those points. What do you want to communicate? And keep coming back to them. They're more likely to use that clip even if you said it a different way. The first time you said it, maybe it wasn't so usable. Second time you said it, it was perfect for exactly what they want for their slot. So be prepared, have a few statistics ready, or maybe an example of what happens in your clinical practice setting, an example with a patient, some scenario, and be prepared to drive your points home. That's a really important piece. The other aspect of media interviews is if you don't know, that's okay. You can just say, I don't know, or even you can say, oh, well, that's outside my expertise area. That's a good way to kind of get around that without saying, like, well, I just don't know what you're talking about, or I don't understand that. Well, that information is outside my expertise area, or that is not available. We don't have that information at this time, or, some way to say that. Better to say that than to have some misinformation, even if we're not sure. Well, I think it's this, but I'm not positive. Better to say than, well, we don't have that information here with us today, but we can get that for you in the future if needed. It's usually not a lot of follow-up opportunities in the media interviews, but be careful not to say something that's incorrect, because unfortunately, sometimes that's the clip that might make it to the news, and we don't want to be getting wrong information out there. The important piece about a media interview is you often don't have a chance to see it before it goes out. So you're watching the 6 o'clock news at the same time everyone else is, hoping that it's all going to come out the way that you intended. And so you don't typically have a chance to review these before they go live. So be aware of that. It is a little more risky, but I encourage you, don't turn those opportunities down. This is how we can advocate for the profession and get pharmacists out there. Find those opportunities, take them, and be prepared for them. So the other area that we'll spend just a few minutes on, probably the area that all of you know probably better than anything else, is really presenting in your content area. So a lot of you have presented at conferences, or again, in your hospital setting, or in front of maybe a lecture at a school, whatever it might be. And here we need to follow the guidelines that we have, whatever that might be in that setting. It's a CE event, it's a research presentation, it's a lecture. Again, knowing your audience, knowing who you're talking to, knowing your time, getting your content materials ready, preparing your PowerPoint, whatever that might look like. And that's probably where we have the most experience in this group. I'm sure there's something in your presentation for everyone. And we're very particular on this. I really try to teach the students this when we're presenting, because you often have students there, and then you'll have maybe technicians, you have pharmacists, you have other healthcare practitioners, maybe you have community members and patients. And so the level of knowledge of your audience, depending on where you're presenting, is typically very broad. And so, yes, you want to have something high level, so you make sure that you're a clinical specialist, or your physicians, or whoever's there in the team is going to be able to get something meaty out of that. But you also want to have enough information that someone who's a technician or a student or a community member is going to have enough information that they don't walk away from that and say, wow, I didn't understand anything. So you want to know your audience well, and you want to have enough in your content area for someone who is very entry level to this topic, and also somebody who might be at a higher level. And again, know your audience and then gear it that way. Ensure your presentation materials can stand alone and are referenced accurately. So this is an important aspect, because your PowerPoint presentation often travels without you. So you give this presentation and then somebody says, oh, can I have your slides? There was some really great information in there. Great, happy to share my slides with you. And then they get forwarded to someplace else and forwarded here. Sometimes I see these things on the internet somewhere on somebody else's site, right, of my presentation or my information somewhere. So you want to make sure you don't have the opportunity to explain it when your PowerPoint just goes kind of elsewhere. So you want to make sure whatever you put in your PowerPoint is well documented, is accurate, it makes sense. It's not just a keyword for you to trigger to talk about something. This is material that can live on its own. And so be sensitive to that as you're preparing it. And then obviously know your content well. And this is what I find is the value is really valuable in doing your presentation in your content area. It's usually not always, our expertise area. So we're usually very passionate about it. We're very excited, and you know this content well. Be confident. You know more than your audience knows. And even if you don't, act like you do, right? So being confident in the interview or in the presentation is really critical. Poster presentations, just maybe a word or two about that. Poster presentations are nice and easy, right? Because we can prepare those ahead of time. We can look over it. We can have somebody else review it. But be prepared even when you're standing next to your presentation to have that 1 to 3 minute overview. When somebody walks up to your poster and says, oh, what's the poster about? You can give that elevator speech, right? In 1 minute, 30 seconds sometimes, right? Start to see your person you're talking to kind of zone out. You want to start to wrap that up. So be prepared. Have your kind of elevator speech ready, include some contact information or maybe a QR code so people can follow up with you if they want to, but an important aspect in those as well. And then just kind of to finalize as a final slide here, what are some general guidelines and recommendations really for all types of speeches and all types of public speaking types of events that you might be doing? Stay within the time guidelines. When I was talking to a few people about timing, and about talks and what are the most important things. Several people commented, short and sweet. Stay within the time period you have. So if you have an hour-long time period, make it 30 minutes so you have time for Q&A. Or if you have 15, like here, I'm probably well over my 15 minutes already that I had already shared about. Again, passionate about the subjects, right? But stay short and sweet. Be accurate. If you don't know, it's okay to say you don't know. And that's really important. Demonstrate excitement, that body language, the smiling, get excited about your material and be prepared. Know what the latest is going on in the news. You can bring in some news media that just came in yesterday right into your speech. That can also be really helpful and really engaging for people that just can connect it to something that just happened in the news recently. So that's what I have for you today. Thought I would share a little bit in those perspectives, but I am happy to take questions, open the conversation for more around public speaking, but also even beyond that on other areas of leadership, and happy to take questions. So Dave, I'll pass it back to you, or we can just open to questions if you like.
Sure, that was great, Christine. Thank you so much. So yeah, if you want to unmute and ask a question, that's fine. If you want to put something in chat, that's fine too. I have a whole list of questions, but of course you managed to touch on just about every one of them, but I promise I can come up with a few more if needed, but I'll open it up to the group though.
Just a comment, Christine, I'm privileged to say that you practice what you preach. You really modeled all those. So it's experiential knowledge that you've shared, which I always play up in teaching leadership, regardless of the content or the topic. So thank you so much.
That's great. Thank you for that. Appreciate it.
I also really enjoy, Christine, that one of the first things you mentioned was nerves, right? It's the question everybody has of, really good public speakers, why you don't even look nervous, and the answer is always, well, no, I am nervous. That doesn't go away. So yeah. I really love that you kind of led with that. But are there any specific strategies that you use if you're preparing and maybe you're a little more nervous for this one than another? Are there things that you do to prepare to deal with those nerves?
Yeah, I think it's a great question. I would say the more prepared you are personally, the easier you're going to ease into these types of presentations. When you are not as prepared as you would like to be, or your materials aren't here, where's my notes, or I can't get my PowerPoint presentation up, or I can't get into the Zoom link, right? I mean, all of those things, that just adds stress and adds additional anxiety before your talk. So logging in early, if it's a Zoom link, right? Have your presentation up and ready to go. Have a backup, all those things. Getting to know the audience a little bit, right? Even before, arrive early to an in-person event and talk to the moderators or to a few people at the conference, so that you kind of getting to know your audience even at a deeper level. Now you can see them in the audience. Oh, I talked to them earlier. Oh, there's that person, and that's going to help. That's going to help in that initial startup. I find that with a lot of speaking, it's the nerves before. Once you get started, you're about 30 seconds into your talk, you're fine, right? And it's like, oh, good. Now I'm talking about what I know, I've prepared well, I'm good. It's usually the hour before, or even that first 30 seconds getting into it. And then honestly, a lot of the nerves go away.
Great, thank you.
Okay, we have a couple of hands up. So Siwon?
Sure. Hi, my name is Siwon Seo. I'm faculty at Albany College of Pharmacy and Health Sciences.
Great.
I appreciate your presentation and sharing tips, especially the media interview, because I once had a situation where I did it impromptu. So it would have been nice to see your pearls before that interview. But my question had to do with if you saw any research regarding tone of voice, because there are certain presenters who speak with a certain tone and inflection that makes it so much easier to understand the material. And to share a little bit about what I've done is, after I present, if I review the recording, I have on occasion fallen asleep to my own voice. And I think it was because it was like a 2-hour lecture. And I was just wondering, because people say my voice is soft and calming, and sometimes I try to be more excited so it doesn't come off so, I guess, I wouldn't say comatose, but induce sleep, right? So have you seen anything about the tone of voice and how certain tones or inflections may make it easier for learners to digest that material?
Yeah, that's great. That's a great question. And certainly individuals, this is your own kind of personal piece of either your upbringing or your background or even your preferences, introvert, extrovert, all of it, right? I do think there are pieces that you can practice and prepare. And that, again, we have watched a lot of recordings of ourselves through COVID and now through all the virtual things that we're doing. And we maybe always didn't see that before. So now we go back and watch these recordings and see ourselves and think, wow, my voice isn't as strong as I would have preferred, or I tail off the end of a sentence. And so I think watching yourself on video and recordings can be very helpful. We do that with the students in our communications class, record them and have them watch them later on. To your question about research in this area, I'm not sure I have any research I can refer to specifically about this, but I would say, I think from our own experiences and from what you have shared even here already, certainly the tone, I think the confidence, the level of your volume. If you have an opportunity, wear a microphone, right? So if you're in a classroom, you're in a setting, be close enough to the microphone or a lapel microphone that's higher up, and make sure that people can hear you clearly and you're speaking with definition, finishing out the last of the sentences, and making sure that that tone is critical. I think it is a very important point. Everyone's situation is a little different, the way you're comfortable speaking. I do think that smiling and animation and a little bit of excitement around what you're doing can also help in that. And it also kind of brings our voice and tone a little bit stronger as maybe we're moving around a little bit or moving your hands. So again, it's finding your comfort area in that. But I think practicing and certainly emphasizing certain contexts or certain words, finishing out the completion of a sentence strongly, I think can really assist in those. But yeah, great comments. Thank you for sharing that.
Thank you.
Yeah, Elizabeth.
Well, thank you so much, Christine, for that great talk. And, going back to what Simone was saying, I host a podcast. And the first time after I recorded my podcast, I listened to it. I'm like, oh my gosh, is my voice so thin like this, right? I was like, this is not how I thought it is. And I spoke to one of my friends who is into the media business, and he said that most of the time we are our own enemy of our voice. We don't like our voice. And he said, don't go with that. And he actually gave me the example of Diane Rehm from NPR. And he said, after she had that issue with the throat, her sound was very, very monotonous, but she still had a great audience. So he said, don't worry too much about it. Just be you, do what you're doing, and that's your voice. People will eventually accept it for what it is. So,
that's right. Be your authentic self, right? Absolutely.
Well, my question was this. So when you start making this public speaking presentations, how do you get a really good feedback? Because many times people approach you and say, it was great, or, I don't know if they don't like it, they ever come and tell you it was, and few people come and say it was great. And, when you're first starting out, it becomes a little hard to figure out, was it really good, or is the people being nice to me, or is they are my friends, they'll always say, or they're not going to take the trouble to come and tell you the things that you should have done to make it better. So how do you get their feedback so that you can improve yourself on your public speaking skills?
Yeah, that's a great question. Well, I would say initially is building some trust with individuals who you feel can give you constructive feedback. So that's kind of in an informal way. So you have a colleague, maybe it's your boss or your department chair or your director or someone in the audience who this is who you report to. If they're listening to you, I think those are great mentoring types of opportunities. An official mentor that you might have, or an informal mentor, even we refer to as peer mentor. So it really can be a colleague who you trust, right? right? And you've built that relationship and say, you know, Susie, I'm going to be giving this presentation. I really want your feedback. Can you make sure you listen? I'm going to, you know, let's meet for coffee next week. I really want your feedback. And I think that's okay to ask that. But I think asking that, you know, is important. We don't have a lot of people coming up and saying, you know, that was a horrible intro. You used that joke. Nobody got it. You know, it's not your authentic self, you know, unless, you know, probably people aren't going to come up to that unless we ask them for it. So I think that's one particular piece. Ask people ahead of time. I would also say that there are some programs that you can do. So you can actually sign up for or attend certificate type programs around public speaking. So like Dale Carnegie types of ones, the Toastmasters. You know, my husband did one of those programs a few years ago, and you know, he loved it. And they gave all these quick little speeches, and they evaluate each other, they talk with each other, and you know, so there are some of those more formal types of programs that you can do where you'll get more formal feedback, but those would be more structured environments. I think in our environment, if we can utilize, you know, mentors, close colleagues, that's probably, you know, where you're going to get some, hopefully some good, authentic feedback. But I think we need it. Your point is well made. You know, and I know, I mean, I feel that I know exactly what you mean, what you're saying, because, you know, graduation event, right? And come up afterwards, there's a reception, and I've got 6 parents coming up. That was wonderful. Thanks so much. And sometimes there's kind of this curt, thanks, that was great. And other times you get kind of somebody stops and pauses and says, that was wonderful. Thank you so much for explaining, you know, the hood. And I never understood why they get this hood and what the colors meant. That was so helpful. Thank you for explaining that. Nobody's ever explained that before. Now, then I'm like, all right, that was good. You know, I'm glad I included that. It was great. You know, as opposed to, oh, thanks for being, that was wonderful. Thank you. You know, so there are some times you can really truly get a sense on, you know, whether what's happened is really good. But I think asking for that, you're going to get some better responses. Okay, great. Other questions or comments, or even beyond public speaking, happy to answer other questions as well. Okay, I've got one here on the chat. Hello, Christine. Great presentation. What has been your favorite presentation that you have given in your career so far? All right. Question. I have to say that probably the white coat ceremony and the graduation ceremonies every year, I mean, they are, I wouldn't say it's one particular one, but they are probably for me most of my most exciting time to see the students come into our program. We do now our white coat ceremony in the orientation week. So it's literally the students have been with us for 4 or 5 days. We now have an online pathway, so our students are flying in from all over the country. We're just getting to know them. And the smiles on the students' faces, right, as they're engaging with us, is extremely rewarding. And so when I'm giving that speech at the beginning, explaining things or giving a talk, and watching them, this excitement of everything new. And then I fast forward 4 years later and it's graduation, and those same students are sitting there with a smile on their face. Now their hair's different, right? They're look 4 years older. They've got their cap and gown on, and it is an extremely exhilarating time. And I'm excited. They're excited. I don't think there's much. I think for me personally, as an academic and as a dean, it's one of the most joyful times that we have in administration with our students. There's a lot of struggles along the way, right? Students will have a challenge here, or some exciting thing will happen there. But that graduation day is they've persevered. And to be a part of that with them and be able to congratulate them and give them my words of wisdom, they may be small and pieces that I can share, is probably the most exciting for me personally. Other questions? Yeah, something else in the chat? Okay, no one just popped in. What are your best tips for people who have a fear of public speaking? I once had a student that nearly cried when she had to present a report to a small group of staff. I always remember this situation as I struggle how to guide someone with such intense fear. Yeah, it's tough. I really think that practice can help. As clinicians and as healthcare providers, we can, there's a true anxiety piece here that we can have some medical intervention there as well that could also really assist. Test anxiety is a real thing we deal with in the academic side with our students as well. So truly that fear and that nervousness. But I truly believe the more preparation that an individual has, the confidence they have in their content area, and the practice of that, maybe a trusted person sitting right up front. So if you're the preceptor for that student, you work with them. I've done presentations with students 2, 3, 4 times before we go and present it to the individuals we need to, right? And so working with them, getting them to trust you, and then you're sitting there, right? And they're looking at you while they're giving your presentation, hopefully comforted by you and not nervous in your setting, but hopefully that can help. But it is challenging. There's certainly some people have more anxiety around this topic than others, but I'm a firm believer that the practice and the confidence and the knowledge of your content area will help.
Christine, there's another question in the chat about how do you manage stuttering or maybe getting tongue-tied? And I was going to ask a similar question about, if you're one of those individuals who use filler words a lot. Of course, you didn't use one or through your entire talk.
No, I've used plenty of them too.
No, yeah. Well, not that time. But are there strategies that you can use to overcome that?
Yeah, that's a great question. Stuttering is a real thing. I don't know if anyone's seen the King's Speech, I believe is the movie. That was outstanding, and really kind of see how an individual worked through a true stuttering impediment to really overcome that. But certainly the ums, right? I mean, I hear myself saying it. I'm conscious of it. I think being aware of that, recording yourself and listening to that and realizing how many times you say a particular word or the or you're thinking through something. I find that when, again, I'm very engaged with the material, that there's going to be less ums and pauses and these trying to find the word. I think we all do it to some degree, but again, the experience, the practice, the confidence in the content area, especially if you can really engage with the material. And so you're telling the story without really even having to look at your notes or referring back to the PowerPoint. You're explaining it from your heart, from your mind of what you know of this content. It's typically going to flow more smoothly. So it is certainly something to be aware of. I think recording yourself, listening to that, even noting down if that's something you really struggle with, noting down, wow, I said 14 times in that 5-minute presentation, and then working through that again, record yourself again, be conscious of it, and see if you can reduce that down. I think those are very real scenarios that you can work on. I'll just say too, as I'm answering some of these questions, if others have comments and ideas on some of these points, I welcome that. I am not an expert in this topic. I have experience of doing it, much like many of you, but I know in a room like this, there is tons of experience in public speaking. So if others have tips on some of these areas, I certainly welcome them. I'm sure Dave would as well.
And then there was a somewhat similarly related question. Any tips for fast talkers?
Yeah, absolutely. So I think, again, practice, being very conscious of that, really slowing yourself down, right? We all tend to get excited, especially when we're nervous. We're sometimes running through something very quickly. Remembering your audience, keeping in mind how you've heard speeches and can't follow what's happening if someone's talking too quickly. So again, I think really practicing it, timing it, And if you practice the first time and it's 5 minutes and you think, wow, that was so fast, really, we want to make this a 6 minutes or 7 minutes. Really practice that time yourself, really purposely trying to slow yourself down in that realm. Especially if you are using a PowerPoint or some notes, you can kind of gauge yourself in that way. Get yourself a pause afterwards. It's okay to have a pause. Sometimes in my written speeches, I will do that where I'll actually put pause. I will write the word pause, or I'll write the word clap. So even, congratulations to the graduates, right? And so that again slows things down. It's okay to put that in your notes, but it's notes for yourself. Pause, breathe, right? Whatever it might be, to actually give yourself a second to come up for air before you come to your next point you want to make. Yeah, Elizabeth, please.
Oh, I just wanted to make a point on that. Christine might be knowing this. I come from the southern part of India, and we speak very, very fast. Especially if you're making an international call, users, we can go like that.
That's great.
When I first started as a graduate student, and I had this issue because I'm excited about the topic, it's my research topic, and I speak fast. So I used to speak fast. And the one thing that I did a lot stage, you have a tendency to go fast. I always had someone, like the way you said, for giving you feedback, I had someone in the audience who will kind of raise their hand slowly to show me that you're going fast. Right. Like the timekeepers who show you have 3 minutes left. So, that person will kind of slow up their hand. So I know that I'm going fast. So then it took a couple of years before I think I really narrowed it down, but that used to help me a lot because, I speak fast.
That is great. So again, a trusted person in the audience, I think if you're very concerned about these particular areas, right? So getting that feedback from someone, having someone in the audience who's going to give you a guide, 5 minutes, right? 2 minutes, that's super helpful for keeping yourself on track, or slow it down, or, whatever it might be, right? These are like baseball hand signals now, but you come up with them with your, with a trusted person. That's a great point. Thanks for sharing that. Yeah, Victoria.
Yeah, thank you. I had a question regarding, now that we're in this limbo after COVID, I have presented and also ran meetings hybrid, so having in-person and virtual audiences, and I've gotten a lot of feedback regarding how to juggle both of them and balance your content to ensure that both of the audiences are having a positive experience. Do you have any advice or feedback that you've received regarding those types of meetings or presentations?
Yeah, that can be challenging. I think that's an important point now when we are asked to present somewhere. Is this going to be over Zoom? Is this virtual, or is this in person? What is this? Or is it a combination of the both? And I think we have found the most challenging is when it's a combination of both. You're in a room that maybe you're presenting to a group that's there. You tend to have eye contact with them. You tend to be moving around the room, and you kind of forget about the audience that's on Zoom, who might just really be listening in as opposed to participating. We can't see them as clearly. Sometimes we're missing their input in the chat. I mean, this is happening in meetings. You guys likely are encountering this now already, but we in the classroom, we did a lot of this during COVID, where we had half the class virtually and half the class in person. And the faculty really found it very challenging. We almost need a second person to be monitoring the chat in the Zoom room, which can be very helpful, while you in the classroom can kind of engage with who's there. And then someone else is saying, we have a question in the chat, or there's someone online that has a question now. And so that can really be helpful. It's interesting as we're doing Zoom today, and I think many of you experience this, in some ways, Zoom is it works very effectively for this. I can see all of your faces, at least those of you that have your cameras on. And I can feel like I'm engaging with you, right? You're talking with me. You can see my face clearly. I can see yours for those that want to engage. The challenge becomes, I think, for individuals, for the speaker, I will say, when people have their cameras off, which is the majority of the group here. And I'll say during COVID, when we were teaching in the classroom, a lot of the students had their cameras off most of the time. So literally you are talking to a group of names. sometimes there's only one student, two students, or one or two people. It's much more helpful and easier for the speaker if you can see people's faces. So we started in the classroom, and in our online pathway, we do have a requirement. Everyone has to have their video on all the time. And that is a critical piece. So that can be something of, at the beginning, can everyone please turn their cameras on? Who can, right? And if we can tell them that ahead of time, because they might be in settings where they couldn't, or, still in their pajamas or whatever it might be, but that can really help in that way. So hopefully there were a couple tips in there that helped with some of your questions that you had commented on.
Yes, thank you.
Okay, great. Okay, any other questions or comments? Any other tips from anyone in the room? Again, I know there's a lot of experience here, so we welcome that.
I'll make a humorous point. Winston
Okay,
Churchill,
please do.
Winston, I'm A.B. Yeager, by the way, professor of SBA at TCOP, I'm a psychologist, not a pharmacist. In any case, Winston Churchill was known of saying, I viewed a whole audience as monkeys. That was his way of coping.
Excellent.
Now, it in jest, because if it doesn't help you and you start thinking of it, you're gonna laugh and things will get weird. But anyway, just a quip from history.
I think that's great. Be your authentic self and find what works for you, right? So if it's, they say, imagine people all with with no clothes on, right? Or they're all monkeys, or, they're all jumping up and down, or whatever it might be. They're all ignoring you. Nobody's listening to you. Everybody's got their head turned, whatever. Imagine whatever it is, whatever works for you. And I think find that kind of comfort place of what makes you comfortable. But yeah, no laughing, at your audience, and that
monkeys may be more attentive than electronic signals.
It might be, over Zoom. Certainly.
Anyway, thank you. Thanks again. You really just struck more than a chord. You just took a topic and really made it so succinct and leaving us with some resources. Thanks again.
Well, good. Thank you so much. Appreciate that. Yeah, I hope some of the tips and comments are useful. Appreciate everyone who spoke up and shared their tips and recommendations as well. Again, I think being your authentic self and finding tips that work for you and prepare well, right? I think that's the takeaway. So thank you guys for today. And Dave, thanks for the opportunity to be here with everyone.
Thank you, Christine, for your time and the great presentation and discussion. Appreciate it.
Great. Thank you.
Thanks, everyone.
Thank you.